Okay. So at this time, guys, we're gonna take a look at his knee, and I'm going to demonstrate some of the core physical exam techniques of someone who has an injured knee. And we're going to be checking ligament structures, the medial collateral ligament, which is called the MCL, the LCL, lateral collateral ligament, the anterior cruciate ligament, the ACL, and then also we can do the PCL. You know, those four ligaments are typically what you're going to be checking each time someone comes in with an injured knee. We want to make sure those are intact. So at this point, guys, what we want to do is now I'm going to demonstrate how we examine a patient who comes in with an injured knee, and some of the core things that we like to do, and I want to teach you how to evaluate the main ligaments of the knee. Those are again, the MCL, the LCL, the ACL, and the PCL. And one of the things that I always like to do when I examine a patient is to make sure that their quadriceps tendon and the patellar tendon is intact, and that's called the extensor mechanism. Oftentimes we can miss that injury unless we ask the patient simply to raise their leg up like this and to hold it there. And you can see Andy, one of your fellow students, he can do that. So that tells me that the quadriceps tendon and the patellar tendon are intact, and also there's no displaced patella fracture. Key thing to do every time you examine a patient who has an injured knee to make sure we don't miss that, because that's one of those things that if you miss the acute diagnosis, you can put that down, Andy, thank you. And what happens is that if you miss the acute diagnosis, as time goes on, it's much more difficult to repair those tendons, and then that can be a big deal for the patient. So always check that the extensor mechanism is intact, and simply doing that straight leg raise is all you have to do every time you examine an injured knee. Now when we want to examine the MCL, so we put them up basically at about this angle, about 30 degrees of flexion. And what we like to do is to stress the MCL, we can create a valgus stress. So what I do is I'm going to kind of go like this, and Andy should feel that inside of his knee, that ligament, kind of having stress. Now, he doesn't have any significant injuries to his knee, so it should feel pretty good, and there's a nice good end point, and I can't really open his knee up. So that means the MCL is in good condition. Now when I go the other way, kind of do the same thing here. Sometimes you'll then put that foot underneath your armpit, and I'm going to check his LCL. I'm going to create a varus stress, it's called. And if you feel that ligament on that side kind of get stressed, and I can feel it kind of give a little bit and then come back. Someone who has disruption of that ligament will cause quite a bit of pain when you start to do that. And if there's a significant injury to the ligaments where it's a complete tear, it will open up and be quite unstable. So that's what we're checking for, stability and for pain. So first pain, and then stability. So that was our MCL. Quickly kind of back like this. You check your LCL. We kind of will do that. And then we want to check that ACL. We'll bring this up like so. And what I always do is I always sit in the patient's foot. So Andy, don't move that. And you have to tell the patient that, otherwise they keep moving their foot out of the way. So what you do is you put your thumbs right in the joint line, just above the tibia there, the proximal tibia. And then I put my fingers on both sides there. And I tell the patient, tell the student, now I'm going to pull you towards me, and you're going to kind of come this way, so be ready for that. And kind of go like this. Maybe Andy, just bring it up a little bit more. There you go. And then what we do is kind of come like that and down. See how I bring that forward? You can probably see how that comes forward, and this ACL is stopping it from coming any further, and then it goes back. It has a nice solid end point, so it tells me it's intact. So that's called the anterior drawer test to check the ACL. And also you can check the PCL by pushing backwards and seeing if the tibia moves posteriorly. You don't see any of that on Andy. So his ACL is intact, as well as his PCL, anterior drawer, posterior drawer test. And some patients can also do a Lockman's test. It's a little harder to do, more advanced maneuver, where basically we relax the leg and kind of bring it forward and back. That's called the Lockman's test. That's really something I really don't ask medical students first and second years to really do a lot of that. I'd rather have you learn the anterior drawer test. It's a little easier to do, but that's called the Lockman's test when you try to translate it back and forth. Okay, great.